Hey. Hold on. I'm trying to get this button. It's really annoying me. 1 second. Okay, I think I got it. There we go. Hey, y'all. All right. I'm a little late, so I'm letting y'all come in. All right. You know what time it is. It's NCLEX Jeopardy. NCLEX Jeopardy. Hey, boo. Hello. All right, guys. You already know what it is. Nurse Sam here. All right. We are doing our free NCLEX Jeopardy review. Okay, if anybody has not been to NCLEX Jeopardy before, hello. Hi, guys. I know, my bad. If anybody's never been to NCLEX Jeopardy before, this is our free review. We have 5 categories. It's really Jeopardy style. It's a game. We play for prizes. It's really fun. You can play whether or not you're a practical nursing student, a registered nursing student, or LPN, RN that just needs to like refresh, a bit of a refresher, especially if you're like moving specialties, especially if you're like in med surg. And listen, if you don't use it, you lose it. Okay, it's literally impossible to remember everything from nursing school, so this is a great refresher as well. But for everybody that is in nursing school, let's go over the categories. 1 second. This one. 1 second. I want okay, is it this one? No. I want my maternity one, and I mislabeled it. Found it. Okay, cool. All right, guys. So our categories for today, we have 5 categories, 5 questions per category. So every week you guys get 25 brand new questions to help you guys in your review. Okay. All right, awesome. So tonight's categories are pharmacology, fundamentals, mental health, maternity, and pediatrics. I know earlier today I uploaded my award from LPN school literally 8 years ago. Okay, and that wasn't because I had a job in maternity. It's just because I did so well in that class. Okay, she aced it. She aced maternity, and I gave you guys the tips that I personally use as a visual learner and the type of learner that I am. I gave you guys the truth and what I really used to help me get from, I don't remember what my first original grade was, but I rocked maternity. I definitely ended it with like a 90 something. I can't remember. It's in the post. But we also have maternity as a category today. So just in case there's a lot of you that may be interested in like maternity, OB, this is a perfect practice for you guys. Okay. Wait, it's still frozen? Or can y'all see me? I'm not frozen. It may have some connectivity issues right now. I'm not frozen on my TV. Will this help with RN school? Absolutely. Just said that. This will help with LPN, RN. Yes, you need to answer just like Jeopardy. All right, I'm going to go over the house rules. So just in case anybody is a first timer here. By the way, if you are a first timer, let me know in the comments below. If you are a repeat offender, welcome back. Once again, my name is Nurse Sam. I'm a licensed practical nurse. I have been so for 8 years. Currently, I am not bedside. I'm retired from bedside. Thank you, God. I am retired from bedside, and I am dedicated 100% to this business, to the Nurse Sam Global Media, where I help you guys, LPNs and RNs, PN, RN students, to thrive and survive in nursing school so that you guys can graduate, take the NCLEX, pass that thing, and become the nurses that you guys want to be. So, like I said, it is good for RN, LPN. I even have some NPs in here because, like I said, the information is not going to change. Facts are facts. Okay, so a little bit of house rules. Okay, so I'm going to show you guys what we kind of are working with so you guys can kind of see the screen. This is what I mean by like NCLEX Jeopardy, okay? It is truly Jeopardy style. All right, so yep, those are our categories. Do not laugh at my tabs. I have 100 tabs open. Those are our categories, and that's exactly how it looks. Okay, now We play for about an hour. We play till about 8 p.m. But you Rich can barely get out. I'm sorry. We play till about 8 p.m. But that's not when the fun starts, okay? If you guys want to continue on or review these questions, what Louis Vuitton? If you guys want to, if you guys wanted to play the mobile version, you can download the Nurse Sam app for free. Just go to your Apple store or Android. I think it was called an Android store. I don't know. I have an iPhone, team iPhone. But it's definitely iOS and Android compatible. 100% free. Just type in the Nurse Sam. It's a free download as far as the app. And then go to NCLEX Prep and hit NCLEX Jeopardy Mobile. You guys can play all day, whenever you want. On the bus, on the train, in the car, in church. Don't play in church. As far as the house rules for the game today. All right, so obviously it's Jeopardy style, so we're going to play like Jeopardy, okay? In order for you guys to be considered a winner and to actually qualify to be on the board, because like I said, we're playing for points. So like I said, 5 categories. Each category have 5 questions. They range from 100 points all the way to 500 points. It can be anybody's game. All right, so what happens is when I read the question, I'm going to read the answer choices as well. You guys are going to comment what is and then whatever the answer is. It is multiple choice. The answer choices are like 1, 2, 3, and 4. So your answer is probably going to be like, what is 1? What is 2? I don't know. It's good. As long as it has what is and then whatever the number is or whatever the answer is, that's how you submit your answer. And whoever answers first on my screen, because we know connectivity, especially on IG Live, what's on your screen may not be on my screen just because of the lagging. That doesn't happen too often, right? She's beat. That doesn't happen too often, but just in case there's some lagging, just know that I can only go by what I see on my screen, okay? But I want to reiterate that it can be anybody's game, but also reiterate the fact that this is a game, all right? It's to help you guys be motivated, so you guys want to actually study, we're having fun, all this stuff. But as long as you get the answer right, that's really what I want you guys to take away from it. And even if you get the question wrong, we're going to go over the rationale, the detailed step-by-step rationale. If there's any calculation questions, we always go through it. Like I show you guys exactly how I go through it step by step. And if it's not anything numerical, we're just going to go over the rationale so that if you come across this question again or it's asked in another type of way, you'll have that knowledge so you know why the answer is wrong so that next time you can get it correct. All right. Also little tip. I always share my little tips. It's going to behoove you to probably just copy and paste what is, shave off a couple seconds. So I would probably just literally write what is in the comments and just copy and paste. So that way you can just paste it and then enter your number. The app again is the Nurse Sam. The Nurse Sam. Now, when you search the Nurse Sam, you'll probably come across 2 apps, the Nurse Sam and the Study Bar Community. Study Bar Community is only for members only of the Study Bar community. And that is our monthly membership for nursing students, which I can go into later. But as far as the free app where you can play this NCLEX Jeopardy and Tease Tuesday Jeopardy, if that's what you want, it is the Nurse Sam app. Just go to NCLEX Prep and then you'll see the NCLEX Jeopardy mobile. You guys can play that. It's 25 questions every week. Obviously, on the app right now, you'll see last week's questions because I don't update it until after we go over tonight's questions, obviously, so there's no cheating going on, okay? All right, so with that being said, you guys have any questions? If so, just go ahead and ask them in the comments. We have some veterans here, period. Hey, Boo. Hey, Lauren. Where's my... Unknown Beauty, Chriselle, hey. We have some veterans, so if I can't see the question or I'm asking questions, I'm sure they'll answer the question. And if I see it and I can answer, I'll just go ahead and answer it. All right, so give me a thumbs up if you are ready to get started. Thumbs up, thumbs up, thumbs up if you're ready to get started. All right, so let's go ahead and let me pick the first question, or y'all want to pick? Well, since we talked about maternity, let's just go ahead and do maternity. All right, and we're going to do maternity for 400, okay? All right, so I'm getting some thumbs up saying you guys are ready. Awesome, awesome, awesome. Perfect. Okay, so this is maternity for 400. Remember, whatever you're asking, not answering, whatever you're answering the question, make sure you put what is and then whatever the answer is, okay? All right, so maternity for 400, question number 1. Okay, a non-stress test is performed on a client who is pregnant, and the results of the test indicate non-reactive findings. The primary healthcare provider prescribes a contraction stress test, and the results are documented as negative. How should the nurse document this finding? 1, a normal test result. 2, an abnormal test result. 3, a high risk for fetal demise. Or 4, the need for a cesarean section. What is our answer? Don't forget to say what is. But we know that on the real NCLEX, you don't have to put what is. But just for games, we have to put what is for now, okay? All right, I'm going to run that back, okay? A non-stress test is performed on a client who is pregnant with a child, okay? And the results of the test indicate non-reactive findings. The primary healthcare provider prescribes a contraction stress test, and the results are documented as negative, okay? How should the nurse, aka future y'all, how should the nurse document this finding? Is it 1, a normal test, 2, an abnormal test, 3, a high risk for demise, or 4, the need for a cesarean section? The answer is, what is 4? I'm just kidding. It's what is 1. It's what's 1. Y'all would have been pissed if it's 4. I would have been pissed too, because that means I would have got it wrong. Yes, the answer is what is 1, a normal test. What is 1, a normal test? Let's see who got that first. I think I saw who got it first. Good old Prashelle. Hey, Unknown Beauty. All right, awesome job. So, Unknown Beauty, you are on the scoreboard. Congratulations with 400 points. Awesome job. Now, like I said, we all know that on the actual NCLEX, as long as you get these answers correct, you're on the right way. So I'm still going to give everybody their flowers that answered correct, even though you may not have been first, okay? That's just how we do it, all right? So let me go ahead and like. All right, the Black Ming Lee, hey boo, congratulations. That is correct. DCT, congratulations, correct. Lauren, hey boo, congratulations. Tamar, Pure Buyout. E-Love, Live Your Life for You 22. I love y'all, so I love calling y'all by y'all actual handles. Carter with the CBD, period. Forever Desiree, Cattell, King Ashley, E-Money, period. Awesome job. Sierra, hello. Welcome in. All right, so this is NCLEX Jeopardy. We are playing for prizes. I'm going to read the question. I'm going to read the answer choices. And because this is NCLEX Jeopardy, you really got to answer it Jeopardy style. So you have to say what is before your answer. So that's why you see everybody saying what is 1. All right. Hey, future ER nurse. Hey, boo, hey. All right, so the answer, once again, is what is 1, a normal test. Let's go ahead and dive into the rationale so we can figure out why it was what is 1. And I think, did everybody get that? I think that was a clean sweep. Clean sweep. There we go. I think literally everybody got that. So awesome job, everybody. So it says, contraction stress test results may be interpreted as negative, which is normal, or positive, which is abnormal, or equivocal. A negative test result indicates that no late decelerations occurred in the fetal heart rate. Although the fetus was stressed by 3 contractions of at least 40 seconds duration in a 10-minute period. Okay, yeah. I was like, what? When did it say that? Sorry. Options 2, 3, and 4 are all incorrect interpretations. Now, with that being said, okay, let me go back through let me just repeat the actual answer choices. This is actually a little study tip, so pay attention. All right, so 1 was a normal test. 2 was an abnormal test result. 3 was a high risk for fetal demise, which is an abnormal test result. So 2 and 3 are basically the same thing. And then 4 is the need for cesarean section. You wouldn't need a cesarean section unless something was abnormal. So literally 2, 3, and 4 indicate abnormal test results, and they all say the same thing. So the only one that's kind of left is 1. That's kind of a little trick as far as multiple choice questions. A lot of times you'll have 2 answers or 3 answers that are like the same, but just in different wording. So you got to really know what the test results interpret as. In this case, negative means normal and positive is abnormal, okay? So great job, great job, great job. All right, so that was maternity for 400. Let's go ahead and get to, I'm gonna let y'all pick this next one. Pediatrics, mental health, fundamentals, or farm? Pediatrics, mental health, fundamentals, or pharmacology? Which should our next category be? Make sure you guys are tagging your classmates, your nursing school classmates. Anybody that's in nursing school, does not matter if it's LPN, RN, does not matter. This is great review. So tag anybody that may need this free review. Who's the first person that said something? Farm. All right, so wait, you said farm, right? No, you said fundamentals. All right, so let's do fundamentals for 300. Ooh. This is a good one. All right, this is a good one. And with everything going on as far as nurses being the scapegoats of the law, this is a great question. So you kind of know what you should and should not question. Make sure you CYA, which is cover, ask your mother what it's called. The nurse is preparing the morning medications to be administered to assigned clients, not 39 of them. Sorry, that was petty. The nurse is preparing the morning medications to be administered to assigned clients and has reviewed the primary healthcare provider's prescriptions. Which medication prescription should the nurse question? 1, Lanoxin 0.25 milligrams orally daily. 2, hydrochlorothiazide orally twice daily. 3, docusate sodium 100 milligrams orally twice daily. Or 4, enoxaparin sodium 20 milligrams subcutaneous daily. What is that answer? What is that answer? I'm going to repeat that one more time. The nurse is preparing the morning medications to be administered to assigned clients, safe staff ratios, and is reviewing the primary health care provider's prescriptions. Which medication prescription should the nurse question? All right. 1, Lanoxin 0.25 milligrams orally daily. I'll repeat it one more time. You're looking for the prescription that looks weird and that you should question, okay? So which of these don't really sit right or look right to you as the nurse, okay? 1, Lanoxin 0.25 milligrams orally daily. 2, hydrochlorothiazide orally twice daily. 3, docusate sodium 100 milligrams orally twice daily. Or 4, enoxaparin sodium 20 milligrams subcutaneous daily. I almost chose the wrong answer, and then I was just like, oh wait, I know this one. Okay, good. Let's see what that answer is. Let me scroll to the top to see who answers first. All right, and that answer is, what is 2, hydrochlorothiazide orally twice daily. Let's see who's the first person to get that answer. It is unknown. Look, okay, Unknown Beauty. I keep trying to tell y'all, we have some veterans here. Okay. All right. So Unknown Beauty was already on the scoreboard, love, with 400 points. You just got another 300 added. All right. So 700 for you. All right. Can anybody tell me what was wrong with number 2? I'm going to read it. What is wrong? I'm going to say what is wrong. Let me not give y'all hints. What is wrong? What makes you want to question this prescription written by the primary healthcare provider? It is hydrochlorothiazide orally twice daily. Why would the nurse question that? Absolutely no dosage. No dosage. As you notice, everything else had the medication name, the dosage, the route, and the schedule. So hydrochlorothiazide orally twice daily. How much of it are we giving? Primary healthcare provider. How much are we giving? We don't know. So that's what make the nurse question that. It says the prescription for the hydrochlorothiazide, I was doing so well, is incomplete because the dosage is missing. The prescriptions in the other options are complete prescriptions. It has, like I said, the name, the dose, the route, and the instructions on how to take. All right. Once again, the answer was number 2. Let's see everybody that got that correct. We know that it was, oh wait, where am I going? We know that it was Unknown Beauty that got it first. Pure Buyout, you also got it. Congratulations. Carded with the CBD. Just Being Me, period. Lauren, great job. Sierra Alexa, wait, there we go. Sierra Alexa, great job. The Worthy Journey, amen. Exo Danny, Jujubine, Binta Kib, Nay Day Bay. Remember to put what is for your answer, because this is NCLEX Jeopardy. Mary SWBC, awesome job. Wait, yeah, great job. No dose. Always attend. That's maybe you chose it. Oh no, I just knew it was a diuretic. Hey. Listen, I love to get extra credit, okay? All right, somebody already said that hydrochlorothiazide was a diuretic. What is enoxaparin sodium? What kind of medication is enoxaparin sodium? Answer that for 100 points. Go. What class or what type of medication is enoxaparin sodium? What kind of medication is enoxaparin sodium? What is an anti-coag? I see you. I see you, Smiles. Absolutely. All right, so enoxaparin sodium, that is the generic name. All right, the brand name is that Lovenox? Yes. Enoxaparin sodium is Lovenox. Lovenox is the brand name. Enoxaparin sodium is the generic. All right. And it is a blood thinner and anticoagulant medication. So great job, Smiles. You were the first person to get that one. So congrats. Where are you? Scroll. There you go. Smiles 16. You just got 100 points. Awesome job. All right, great job to everybody else that answered. It is not heparin. It is Lovenox. Okay, heparin is heparin. I think, yeah. Blood thinner, anti-coag. Not the toddler having a meltdown. Oh, poor baby. All right, awesome job, guys. So let's go ahead and go to the next question. All right. Somebody asked, how do I prep for the T's? So on Thursday, we help with NCLEX prep, and on Tuesdays, you definitely need to come on Tuesdays. Tuesdays we do the same thing, Jeopardy, but just with ATIT/HESI. All right. So next question. All right, that was fundamentals. Let's go ahead and do that was fundamentals and / like pharmacology. Y'all see how that just that was a 2-for-1er? Great job. Let's go ahead and go to fundamentals. No, I'm sorry, I just said that. Fundamentals. Let's do mental health. Let's do mental health. Awesome. Mental health for 200. All right, low molecular weight heparin. Okay now. Yes. Oh, Prestige Lash, thank you so much. Great job. Yes, low molecular weight heparin. That is true. Absolutely. All right, so mental health for 200. Here we go. All right, so the nurse in the emergency department is caring for a young female victim of sexual assault. The client's physical assessment is complete and physical evidence has been collected. The nurse notes that the client is withdrawn, distracted, tremulous, and bewildered at times. How should the nurse interpret these behaviors? 1. Signs of depression. 2. Reactions to a devastating event. 3. Evidence that the client is a high suicide risk. Or 4. Indicative of the need for hospital admission. What is our answer? I'm going to give you the scenario once again. Don't forget to put what is. Scenario is nurse in the ER department is caring for a young female victim of sexual assault. The client's physical assessment is complete. Physical evidence has been collected. The nurse notes that the client is withdrawn, distracted, tremulous, and bewildered at times. How should the nurse interpret these behaviors? Answer choices once again. We have 1, signs of depression. 2, reactions to a devastating event. 3, evidence the client is a high suicide risk. Or 4, indicative of the need for hospital admission. What is our answer? Okay, everybody having the same answer. Just being me, looks like you are the first one to get that. It is what is 2. What is 2 is the correct answer and the correct interpretation of these behaviors. All right. So once again, this young female victim, this young female is a victim of sexual assault, and during the acute phase of sexual assault / rape, the client can display a wide range of emotional and somatic responses. Somatic is when that's basically when those behaviors start to manifest in your body. So whenever you see the word somatic, kind of it's synonymous with body or physical. All right. So the client can display a wide range of emotional and somatic / physical responses. All right. Sometimes those emotions are just so deep that it actually causes physical responses. The symptoms noted indicate an expected reaction. All right. So the client, once again, is withdrawn, distracted, tremulous, and bewildered. So all that is consistent with reactions to a devastating event, in which sexual assault is a devastating event. All right. Options 1, 3, and 4, the signs of depression, high suicide risk, and indicative of the need for hospital admission. Those are incorrect interpretations. Okay, so number 2 was the correct answer. It looks like everybody got that. But just being me, you are the first person to get that. So you are on the scoreboard with 200 points. Awesome job. All right, so let's go ahead and give everybody their flowers. Our Ruth Glitz reaction. Remember to say what is. DCT. Congratulations, Lauren. White Girl 13. E Money. E Love. Sierra Alexis. Smiles. RT Travis. Juju Bean. Pure Buyout. Fat Bew. I don't know if I said that right. I hope I did. Kind of sounds like PTSD. Like it's the acute phase of a crisis. So yes, those wide ranges that kind of be synonymous. All right, great job, awesome job. If you need more help with mental health, make sure you check out my mental health study kit. It is Scooby-Doo inspired, so it's I have it on my page, and it's also included in the Ultimate Nursing School bundle if you need a little bit more like colorful and creative help as far as studying for mental health. Okay. All right, now let's do Oh, that's a easy one. Okay, sure, let's do this one. Pharmacology for 500. And then I'll do the easy one afterwards, just to throw that in there. Okay, so this is pharmacology for 500. Remember to tag your nursing student friends, sister cousins, whatever. Anybody that needs help, RN or LPN student or nurse in a bridge program, it does not matter. The information is still going to help you with your NCLEX or even on your exams, even if you're not to the NCLEX point, okay? So once again, Pharm for 500. A client with a peptic ulcer is diagnosed with H. pylori infection. The nurse is teaching the client about the medications prescribed, which include clarithromycin, esomeprazole, I can never say that, and amoxicillin. Which statement by the client indicates the best understanding of the medication regimen? Is it 1, my ulcer will heal because these medications will kill the bacteria? Is it 2, these medications are only taken when I have pain from my ulcer? 3, the medications will kill the bacteria and stop the acid production? Or 4, these medications will coat the ulcer and decrease the acid production in my stomach? What is our answer? I'm going to run that back. A client with a peptic ulcer is diagnosed with H. pylori infection. The nurse is teaching the client about the medications prescribed, including clarithromycin, esomeprazole, and amoxicillin. Which statement by the client indicates the best understanding of the medication regimen? The medications, once again, clarithromycin, esomeprazole, and amoxicillin. Those are the medications, okay? Is it 1, my ulcer will heal because these medications will kill the bacteria? 2, these medications are only taken when I have pain from my ulcer? 3, the medications will kill the bacteria and stop the acid production? Or 4, these medications will coat the ulcer and decrease acid production in my stomach? What is our answer? Let me scroll up. All right, so our answer is, ooh-wee. That's a good one. What is 3? The answer is what is 3. The medications will kill the bacteria and stop acid production. Ooh. A lot of you guys chose 1 or 4, and we're going to get into that. So, first person to say what is 3 is Benta Kib. Bent. Hey. You are on the scoreboard with 500 points. Awesome job. All right, so great job, Bent. Who else got what is 3? DCT, awesome job. I think those are only, NC Pink Rose, awesome job. Nurse Bomb BC, awesome job. All right, so let's go over these medications, all right? Okay, so remember the medications, we're going to go over it one by one, okay? Now remember, triple therapy for H. pylori infection usually include, well, I won't say that part yet. Let's go ahead and go over what the medications are. First of all, clarithromycin. What kind of medication is that? What kind of medication is that? Somebody put in the comments what kind of medicine is clarithromycin. I'm waiting for you to put what clarithromycin in. Antibiotics, absolutely. Esomeprazole. What kind of medication is that? Absolutely. What kind of medication is esomeprazole? Remember, please note your suffixes, okay? Prazole. All right, great job, Dominicana. Awesome job. It's a PPI, proton pump inhibitor. All right, absolutely, yeah. Great job. AKA antacid, but specifically a proton pump inhibitor. But yes, the function of a proton pump inhibitor is to decrease acid. So awesome job. Now, the last medication. So far, we have one antibiotic, one PPI/acid reducer, and then amoxicillin. Can we all agree that we know what amoxicillin is? It's an antibiotic, absolutely. So we have two antibiotics or two antibacterial medications and one proton pump inhibitor. Okay, so awesome job. All right, so the triple therapy for H. pylori infection, it usually includes these medications, and the regimen is usually two antibacterial medications and a proton pump inhibitor, which is exactly what this patient got. So we have antibiotic and a proton pump inhibitor. All right, now the clarithromycin and amoxicillin, those are the antibacterials or the antibiotics. And the esomeprazole, that is the proton pump inhibitor, the PPI. Not PPP loan, absolutely not PPP, it's PPI, okay? Now, the function of an antibacterial is to kill the bacteria. All right, remember, we have our two classes of medication, all right? We have our antibiotics, antibacterials to kill the bacteria, okay? And then we have our esomeprazole, the proton pump inhibitor, which is going to decrease acid production. So as far as the question goes, what statement indicates the best understanding of this medication regimen? 3 is the answer, which says the medications will kill the bacteria, the clarithromycin and amoxicillin, and stop acid production, which is the esomeprazole or the proton pump inhibitor. That's why the answer is number 3. Those that chose number 1, it says, my ulcer will heal because these medications will kill the bacteria. Now, even though it will kill the bacteria, it did not account for what the proton pump inhibitor would do. So that's why that was not the best understanding of the medication. All right. And then those that chose 4, it says these medications will coat the ulcer and decrease production in my stomach. Once again, it's telling you what the esomeprazole is going to do, but it's not accounting for what the antibiotics are going to do. So that's why 1 and 4 were incorrect. It didn't account for the other class of medication. All right, so 3 was the correct answer because it said both. 2 was wrong because it says medication, you only take these medications when I have pain from the ulcer. Absolutely not. Antibiotics and esomeprazole is not going to be what you want to take as far as the pain. No, it's going to get to the nitty gritty. What coats ulcers again? Is it like, I want to say like milk and magnesia. Hold on one second. Pepto-Bismol. That's what I'm trying to say. Like Pepto-Bismol, or like the real name for Pepto-Bismol is like bismuth. Something. I just know that part. Pepto-Bismol, bismuth. Kind of let that do that. So yeah, sometimes it says sometimes prescribers will prescribe it with the antibiotics, but not in place. You remember, you still need a dual action. You need to kill the bacteria and also decrease that acid production. And honestly, depending on how bad that stomach ulcer is, something to actually like coat it. So you're not miserable, obviously. Okay. Let me see if there's any on there. Awesome job. Perfect. Awesome job. All right, so let's go to the next question. Did I call out everybody? I think I did. All right. Yes, sulfate. That TikTok of typing and popping going. I typically, whenever I'm watching and doing deep dives on TikTok, if I'm doing it long enough, usually it'll still be in my mind. So whenever I'm talking with you guys, TikTok will come out. Like that one TikTok, it's like, this bitch will barely get at. That's so funny to me. All right, next question. Let's do peds next. And this one is peds for 400. Ooh, peds for 400. All right, here we go. This is going to be funny. Um, if you guys have been doing NCLEX Jeopardy with me for a while, you know that I always say that some of these questions are, they basically like repeat them. Not these questions, but like in nursing school, especially on the NCLEX and exams, once you've taken enough like practice questions, you'll start to notice patterns, notice like keywords. A lot of times they'll ask like you'll come across the same question over and over again. But let's go ahead and get into pediatrics for 400 really quick. All right, so it says the nurse reviews the record of a newborn infant and notes that a diagnosis of esophageal atresia with tracheoesophageal fistula is suspected, because y'all thought I was going to mess up saying that, but she didn't. Okay. The nurse expects to note which most likely sign of this condition documented in this record. Is it 1, incessant crying, 2, coughing at nighttime, 3, choking with feedings, or 4, severe projectile vomiting? All right, let's go back. Remember, we're reviewing the record of a newborn infant, and we note that the infant has a diagnosis of esophageal atresia and tracheoesophageal fistula. I'm breaking it down so y'all let the words kind of help you, but that's just tips. I'm giving you hints, okay? Esophageal atresia and tracheoesophageal fistula, all right? Shout out to Grey's Anatomy for letting me know what a fistula was, because boy. All right, now, what is the most likely sign of this condition? All right, what is the most likely sign of this condition? Sign, symptom, whatever. 1, incessant crying. 2, coughing at nighttime. 3, choking with feedings. Or 4, severe projectile vomiting. What is that answer? Okay, now. All right, so the answer is what is 3? What is 3? Choking with feedings. Choking with feedings. That is going to be the sign of this, well, the most likely sign of this condition. All right, first person to get that was Bree Lively. Hey, boo, hey. Bree Lively. Oh, no, my pen. Okay. Bree Lively 07. Perfect. You are on the scoreboard with 400 points, boo. Congrats. All right, so everyone that got what is 3, which is a good grasp of you guys. So great job, Bree. Carter with the CBD. E-Love. Sam. I'm trying to hit the hearts. All right, E-Love. Smile 16. Fitness Fashion Fab. Absolutely. Cutie Ash. Benta Kib. Sierra Alexa. Juju Bean. Faith Florence, Forever Desiree, if I can actually hit it. Kenny B. It's Jessica. Stop it, Sam. RT Travis. No, R Travis. Sorry. Fap Review. I got you. Awesome job. Hey, boo, hey. Awesome job. Okay, great job. So yes, the answer was 3, choking with feedings. Okay, so let's get into this rationale. Let's dive into it. So in esophageal atresia, all right, and tracheoesophageal fistula, the main thing that I'm looking at and the main word that I'm seeing, if for some reason I'm having a mind blank, I'm gonna let the words help me as much as possible. All right, esophageal and tracheoesophageal. So something's happening in the esophagus, okay? Something is happening in the esophagus. What is it? All right, so in esophageal atresia and tracheoesophageal fistula, the esophagus actually terminates before it reaches the stomach. All right, it actually ends in what's called a blind pouch, and a fistula is present that forms an unnatural connection with the trachea. That's basically what a fistula is. It is like a tunneling in a actually an unnatural connection formed between two things that's not supposed to be connected. Okay. All right. Any child who exhibits what they call the 3 C's: coughing and choking with feedings, and unexplained cyanosis. So coughing and choking. The coughing was, they almost got y'all with the coughing at nighttime, but it's not. It doesn't matter if it's nighttime, bedtime, 12 p.m., lunchtime. Doesn't matter. They're gonna be coughing pretty much all the time, and especially with feedings. All right. So it's not necessarily that it's coughing at nighttime. It's coughing with feedings. All right, so remember the 3 C's: coughing and choking with feedings, and cyanosis, or unexplained cyanosis. All right, those should all lead the nurse to suspect that there's a tracheoesophageal fistula. Remember, the esophagus terminates before it reaches the stomach. So that means everything that goes down, everything that we're drinking, eating, it's not going to the stomach. It's not going to the stomach. So, and then because of the tracheoesophageal fistula, there's a natural connection between the esophageal and the esophagus and the trachea. So once again, that's going to contribute to, if you just imagine you taking a shot of tequila, I'm just kidding, drinking something or eating something, and as it goes down fine, but it's not going to your stomach. It's rerouting. All right, it's supposed to be going down I-75, but it's just taking a turn on 400. I'm just kidding. I really don't know. All right, so the 3 C's: coughing, choking, and cyanosis. All right, this is options 1, 2, and 4 are not specifically associated with tracheoesophageal fistula. Okay, just kind of remember that. Remember that. Driving down 75. It's not supposed to be a detour, okay? Now, if you live in Atlanta like I do, you know that if you miss your exit, you got to spend 20 minutes turning around, okay? All right, so great job. What is 3 is the correct answer. All right, Be Lively got that one. All right, so let's go ahead and do our next question. Let's do, right, wrong turn. Let's do a good one. Oh, this one's a good one. All right, so we're back on maternity. This one's for 300. Oh, I love these questions because you will definitely get these questions, whether in your exams or on your NCLEX, I promise. Okay. Maternity for 300. Get out your pens if you need to. I'll give y'all a minute because unless you can do it in your head, all right? Okay, so maternity for 300. A client arrives at the clinic for her first prenatal assessment. She tells the nurse that the first day of her last normal menstrual cycle or menstrual period was October 19th, 2020. I'm going to say that one more time so y'all you can get it. All right, when was the first day of her last menstrual period? October 19th. 2020. Keep that, write it down, keep it in your mind, do whatever you need to do. All right. So using Nigel's rule, which expected date of delivery should the nurse document in the client's chart? You have everything that you need. You have everything that you need. Y'all know, do y'all know Nigel's rule? I hope you do. All right. The answer choices, once again. 1, I said once again, I didn't say them. 1, July 12th, 2021. 2, July 26th, 2021, 3, August 12th, 2021, or 4, August 26th, 2021. July 7th is an answer choice. All right, let's repeat that. All right, we have, let's say it's Rihanna, okay? Y'all know that's our celebrity pregnant mommy right now. So Rihanna just strutted in, her and A$AP Rocky. They're there for their first prenatal assessment for what we're assuming is a girl because she was in Target looking at girl things, but that's neither here nor there. All right, so Rihanna told the nurse, Rihanna told y'all that the first day of her last menstrual period was October 19th, 2020. Damn, Rihanna been pregnant a long time. Y'all know what I mean. Just play along. The first day of her last menstrual period was October 19th, 2020. So using Nigel's rule, what's the expected date of delivery of Rihanna's baby? Whatever. 1, July 12th, 2021. 2, July 26th, 2021. 3, August 12th, 2021. Or 4, August 26th, 2021. What is our answer? The answer is what is 2? What is 2? July 26th, 2021. Ooh, Rihanna's overdue and over it. Okay, I'm just kidding. Yes, the answer is July 26th, 2021. Let's go ahead and see who got the first answer. I forget about Nigel. All right, let's see who got it first. Who got it first? Wait. For Smiles. Yep. Great job, Smiles. All right, Smiles, you are on the scoreboard. You are already on the scoreboard with 100 points. Just got another 300 added. So now you have 400. 400. Great job. All right, who else got what is 2 correct? Or July 26, 2021. We have E-Love, E-Money, there's a lot of E's. Benta Kib, Just Being Me, Faith Florence, Mary SWBC. I keep wanting to say SWB. I gotta grow up. Sierra Alexa, Awesome Job, Chanel, 7. Carter with the CBD, Awesome Job. Cool. Can it be? Yep. Awesome Job. I can't with you, Lauren. Negra. Kiss My Dimples. Fat Review. Awesome Job. So yes, the answer is July 26, 21. Let's go ahead and do that. All right. Do I have it with me? I don't. I need to pull that up. 1 second. Maternity. All right, let's go over Nigel's rule. All right, so now according to Nigel's rule, it requires that the woman have a regular 28-day menstrual cycle. So that's what we're just assuming because we're using Nigel's rule. So we're assuming that the client qualifies to use this rule, all right? So in order to use this rule, what you have to do is subtract 3 months and add 7 days to the first day of the last menstrual period, and then add a year to the date. All right, so if the first day of Rihanna's menstrual period is October 19th, 2020, we can do 10/19/2020. Now, it says subtract 3 months. So if we are in the month of October, that is the 10th month. Subtract 3. So 10 minus 3 is 7. So the 7th month is July. All right. So that gives us the 7th. And then it says the next, the 7th month. And then the next part of that question is to add 7 days. All right. We have October 19th. So 19th is the day. So we're going to add 7 days to 19. 19 plus 7 is 26. So we have the 7th month, 26th day. And then you add a year to the date. So 1 plus 2020 is going to be 2021. All right. So what we have is 7/26/21, which equates to July 26, 2021. Does that make sense? Aw, Unknown Beauty. Because listen, Unknown Beauty be racking up these wins. I literally think she has everything on my... I literally think she has everything on my website. But that's because, listen, she's going to pass the NCLEX, period. If she hasn't already. Have you passed NCLEX already? I don't remember. You probably a nurse already. I don't remember. Refresh me, Chriselle. Yes, Unknown Beauty, she has 700 points. So it's going to go to the next person. with the most points. All right, so once again, it is 726.21. That makes sense, guys? Now, you take it in a month. Yay! You have like NCLEX Arcade and everything like that, right? I believe you do, but y'all can hear me? Okay, cool. All right, so if you need help with Nigel's Rule, because I know a lot of people probably forgot about what Nigel's Rule was, make sure y'all check out the baby shower themed mother baby or maternity study kit that I have. You can get that by itself, or you can get that in the Ultimate Nursing School bundle or the 3rd semester bundle. Or you can get access to it complimentary when you are a member, an enrolled member of the Study Bar community. All right, let me show you the page that you would need. 1 second, where is it? Wait for it. Stop embarrassing me. 1 second, computer. Oh, okay, here we go. All right, I'm gonna show y'all. All right, wait. Okay, so this is page 16 of the maternity study kit, all right? And it's going to tell you how to calculate the due date, Nigel's Rule, all right? So you got your first day of the last period. What you're going to do, you're going to subtract 3 months, add a year, and add 7 days, okay? That's how you're going to get the Nigel's Rule. If you need a refresher, you can find that in the maternity bundle, maternity study kit, or the ultimate bundle, whatever. So great job, guys. Awesome, awesome. All right, perfect. All right, let's do one more because I came in late. Let's do one more, and let's make this one a 500er just so we can, whoever gets it, gets it. I want to find a good one. One second. I want to really find a good one. What? That's crazy. Y'all really need to download the app so you can play the rest of these questions, because we don't get to all 25 questions, which is why I give you guys the, free access to the app, because I want y'all to get access to these 25 questions. All right. We go over, some of the good ones, but there's some ones that are in here that I really want y'all to go over. So make sure y'all download the app so you can play the rest of them for the next week. Okay, this one's pretty simple enough. This is Peds for 500. All right. The nurse has a prescription. This is also like fundamentals too, so it's kind of like a 2-for-1. The nurse has a prescription to give ear drops. The app is the Nurse Sam. The Nurse Sam. Literally my logo. White background, Nurse Sam. Black and gold. The nurse has a prescription to give eardrops to a 5-year-old child. This is Peds. All right, we're giving eardrops to a 5-year-old child. Now, which position should the nurse use to pull the pinna of the ear? A year of the ear. We have a 5-year-old child who's getting eardrops. Which position should the nurse use to pull the pinna of the ear? 1, upward and outward. 2, upward and backward. 3, downward and outward. Or 4, downward and backward. I'm going to repeat that one more again. 1, upward and outward. 2, upward and backward. 3, downward and outward. What? Or 4, downward and backward. What is that answer? Remember, the child is 5 years old. And we're giving eardrops. I'm going to repeat the options again. 1, upward and outward. Not upward and onward. All right, this isn't college. Upward and outward. 2, upward and backward. 3, downward and outward. Or downward and backward. What is our answer? The answer is what is 2, upward and backward. You raise it up and pull it back. Okay? Hold on 1 second. Let's see who got it. Up. So who said up and back? Up and back. Up and back. Up and over to what is 2? I think it's E-Money, 826. Yep. E-Money, 826. Awesome job. Woohoo. All right, E-Money, you on the scoreboard with 500 points, boo. Oh, Lord, that just tied you with Bentakib. All right, so we're going to have to do a tiebreaker, y'all. Where you at? E-Money, 826. All right, 500 points for you. All right. All right, so here's our rational. Let me go through. E-Money got it first. Fafferboo, you also got it. Great job. Upward and back, upward and back, upward and back, upward. Andy Green, great job. A lot of people said down and back. Yeah, a lot of people said down and back or down period, but a lot of people said downward and outward or something like that. Let's get into the rationale. All right, it says when giving eardrops to a child older than 3, remember the child is 5, the pinna is pulled upward and backward. To administer eardrops properly to a child who is younger than 3 years old, the pinna of the year should be, I keep saying pinna of the year. What is wrong with me? This is not an award show. Okay, this is not peds, the Grammy for the peds. All right, no. Pinna of the year. Actually not. Pinna of the ear should be pulled downward and backward. All right. How would I remember this? So if we're looking for, all right, so if we're administering eardrops to a child below 3, younger than 3, so below 3, we're going to pull it down. All right, so we're using that. Okay, 3 and lower, we're going to pull that pinna lower or pull it downward and then pull it back. Down and throw it back. I'm just kidding. And then obviously if the child is over 3, if they're upwards of 3, you're going to pull it upwards and back. No matter what, you're pulling that thing back. So honestly, if like I said, no matter what, whether you're pulling it up and down, at the end of the day, you're pulling it back as well. The age is going to really dictate whether or not you're pulling up or back. And 3 years old, it seems to be the default age, I guess. Yeah, that's going to be the age that they're going to use as far as setting the standard. Let me say that. So once again, older than 3, if you're upwards of 3, where are you going to pull the ear if you're upwards of 3? Up, okay? If you're younger or if you're downwards of 3, you're going to pull that thing down, okay? So you can kind of use that to help you. If anybody else kind of has, yes, you remember that age for 3. You know what can help you remember it? So obviously you're administering eardrops. If you look at the ear, hold on a minute. If you look at the ear, I'm gonna draw an ear. You can also kind of draw a 3 in it. Hold on, 3. All right, you see that? So whenever you think of an ear, I want you to think of the our eardrops, and you need to remember that age. Just think about drawing a 3 in that ear, because if you look at the ear, it kind of looks like a 3. It's more like a kidney or a bean, but if you close one eye and squint with the other one, you can like make a 3. You feel me? So that's how Nurse Sam's brain would remember it, honestly. And now I'm gonna look at everyone's ears and draw imaginary 3s. I almost wish I didn't say that, because now I'm never going to unsee it. I'm never going to unsee it. Okay. All right, so once again, the answer was 2, upward and backward, because we have that 5-year-old child, and 5 is upwards of 3, which is a shape of an ear, upwards and backwards. So great job. All right, Bentakib and E-Money. Well, really, it's Ununbeauty. She has 700 points, but she is giving you, donating her prize to either Bentakib or E-Money. Bentakib or E-Money. All right, so we're going to do, for you guys, I want Bentakib and E-Money to answer this next question, okay? This one's going to just be a 100-pointer. to answer this question before my computer dies. Wait for it. Wait for it. One second. Okay. Y'all ready? All right. The nurse is preparing. I mean, everybody else can answer it too, but I'm just looking to see out of Bentakib and E-Money who answers it first and answers it correct. Yes, of course. All right. So, you too, and everybody else, if you want to answer just to practice. This is pharmacology. The nurse is preparing to administer a dose of naloxone intravenously to a client with an opioid overdose. Which supportive medical equipment should the nurse plan to have at the client's bedside? 1. Nasogastric tube. 2. Paracentesis tray. 3. Resuscitation equipment. Or 4. Central line insertion tray. I had to look at what the answer was because I thought I could get it wrong. That bitch could barely get up. I'm just kidding. Once again, we're about to administer a dose of naloxone. What's another word for naloxone? I'm going to tell y'all. It's Narcan. All right. Naloxone is the generic for Narcan. Okay. AKA party's over, baby. You're waking up. All right. We're giving that intravenously to a client with an opioid overdose. All right. Probably the D. Probably the D. Which supportive medical equipment should the nurse plan to have at that bedside? 1. Nasogastric tube. 2. Paracentesis tray. 3. Resuscitation equipment. Or 4. Central line insertion tray. Do not forget, we administer this medication whenever there is an opioid overdose. Okay? All right, so let's see who got them correct and who of my two got it. Hey. E-Money. All right. It was E-Money. What is 3? Well, E-Money out of the 2. Awesome job. So yes, the answer is what is 3 resuscitation equipment. All right. Everybody else that got what is 3, awesome job. And great job for knowing that naloxone was Narcan. You got to know those generics. And honestly, I learned you don't have to learn what the, because on the NCLEX, PN or RN, you're not going to get any I'm going to say trademark names. You're not going to get any brand names of anything. You're going to get generic. But in real life, and also it just helps with memory as well. I always just kind of learn both because really in real life, you're using more the brand name more often than not, just because it's either easier to say or easier to remember for the actual clients. So a lot of times it'll be like that. So knowing both can help you greatly. Okay. So yes, great job for knowing that naloxone was Narcan. Opioid overdose. We know that whenever we have any type of overdose with opioids, the biggest risk is respiratory depression. Okay. It says the nurse administering naloxone or Narcan for suspected opioid overdose, probably from the D, should have resuscitation equipment readily available to support that naloxone therapy if it is needed. So other adjuncts that may be included or that may be needed include oxygen, a mechanical ventilator, and vasopressors. Once again, I like to call the Narcan the party's over drug. The party's over drug. Okay. Listen, that wakes them up real quick. So awesome job to everyone that said resuscitation equipment. Great job. And the first person to get that, once again, is E-Money. So E-Money, that was actually a 200-pointer. So you actually ended, and you are the winner of tonight's NCLEX Jeopardy. Awesome job. So E-Money 826, go ahead and DM me your full name and your email address, and you have just won a Ultimate Nursing School bundle. Awesome job. If you already have the Ultimate Nursing School bundle, let me know what other study kit or digital resource you would like. You can get the NCLEX Arcade workbook, the Critical Care Study Kit, or if you don't have the Ultimate Nursing School bundle, the Ultimate Nursing School bundle. All right. So great job. Just remember to DM me that information, your name and your email address. Congratulations to everyone that came and participated, everyone that got anything correct, even if you weren't first. Like I said, as long as you get those answers correct, practice makes perfect, so that when you take the NCLEX, party's over. You're giving Narcan to the NCLEX, okay? I'm just kidding. That made no sense. All right, let me see. Yes, focus on generic names for board purposes. Like I said, I learned both, but especially because during drug cards, you literally got to put brand name then generic, so it kind of just went hand in hand. But on the boards, you're only going to see generic. Okay. Awesome job. Yay. I'm looking through y'all questions. One second. Awesome. Yay. All right, guys. So once again, thank you guys for joining me for NCLEX Jeopardy. You guys know we do this every Thursday at 7 p.m. Eastern Standard Time. We always upload our replays. Well, the only way to access our replays, just in case you want to watch this and any other NCLEX Jeopardy replay, which is a great review, by the way. Like I said, we do this every Thursday. And the only way to get into access the replays is if you are a member, an enrolled member of the Study Bar community. You get access to the video vault that has literally every replay since like November, September, or something like that. So right now there's probably like 16 or 17 NCLEX Jeopardies. Same thing with Tease Tuesday Jeopardies. You get access to all other like 20 plus videos in the video vault. You also get access to the study kits, you also get access to the study kits and our monthly live Q&As. You get to network with all the other nursing students that are enrolled in there. And it's really like a family of, like I said, it's a monthly membership for nursing students, PN or RN. And what better way to get the support that you need, whether it be just motivational support, accountability, or just finding your study buddy, okay, than to actually be amongst people that understand what you're going through the most, okay? I don't know what that comment is. All right, so once again, if you guys want to play the rest of these questions, make sure you download the app, the Nurse Sam app. It is 100% free, so you guys can play the rest of these questions. All right, so let me go ahead and actually upload the new question so that when you download the app, you will now see the questions from tonight's NCLEX Jeopardy. So let me go ahead and boop. Let me go. I lost myself. Here we go. All right, so let me go ahead and upload that so you guys can have your NCLEX Jeopardy from tonight. Congratulations to all the winners. So give that about 5 minutes so it can actually refresh, and you guys can go ahead and play the same questions. Not the same questions. Oh, yes, the same questions plus more of the ones that we didn't get a chance to go over for your weekly review, okay? I will see y'all next Thursday. And if you want to come for ATIT's prep, which is entrance exam, some people like to prep for both, especially if you're already a nurse or if you are studying for the NCLEX now, but you're about to jump into that bridge. You may need both. So Tuesdays are for ATIT/HESI, entrance exam, not exit. And then Thursdays are for NCLEX or your exit exams. I don't know what it is. It can definitely help. But specifically for your NCLEX, both PN and RN. If y'all have any more questions, go ahead and hit me up. Do not forget to check out the link in my bio. Check out the Study Bar community. And check out our bestsellers, including the ATIT Study Bundle and the Ultimate Nursing School Study Bundle. I will see y'all next week.